Hi, good evening, everyone, and welcome to the COVID-19 Community Town Hall, which is presented by UP Health System Portage. We want to welcome all of our viewers and listeners that are joining us tonight on the Zoom webinar on Facebook Live, on 97.7 The Wolf and Q107 over in Marquette. It's great to have you with us. Our virtual broadcast tonight is coming from Michigan Tech University here at the Student Development Complex. Tonight's topic will focus on COVID-19 and provide updates and recommendations about COVID and also general health. To do that, we have a panel of experts here tonight to provide information and importantly answer questions that you might have. Just want to take a minute here and recognize our sponsors, which include UP Health System Portage, the Michigan Health Endowment Fund, and the Blue Cross Blue Shield Foundation of Michigan. It's great to have their support here for our March COVID-19 Town Hall. We also appreciate the support of the Health Research Institute. Their mission is to support health-focused research, education and training, and community outreach here in the rural Upper Peninsula. The goal of each town hall is to help increase awareness about COVID-19 and how it impacts your health and society at large. And as we look ahead and build forward from the pandemic, we'll start to talk less about COVID-19 and more about general community health here for our region. Just want to remind folks that all of our town halls are publicly available. They are recorded and archived on our website. That website is mtu.edu/health-research. If you go to that page and click on Town Hall, you can pull up all of our previous recordings. And tonight's recording will also be re-aired on TV this Sunday at 12 p.m. Eastern on ABC 10. So be sure to share that with anybody that can't tune into the live broadcast here tonight. Next, I want to welcome in my colleague and co-host for tonight, Kelly Kam. Kelly is a college professor here on the campus. She's an epidemiologist by training and a member of the Health Research Institute. So Kelly, welcome back. Tonight's our 26th town hall. We've been doing this every month for quite some time. So thanks for being here with us. Can you tell us who's here tonight and what's coming up on our town hall discussion?
Absolutely. I'm glad to be back. So we're going to start off our discussion tonight with two different physicians. So we're going to start with Dr. Keith Wright, who's a primary care and internal medicine physician at UP Health Systems Portage. And he's going to be talking about something we really haven't spoken about much. As we get more data, we find out more, and that is these long-term COVID or the chronic COVID that we have that's showing up in some of our patients that have recovered from the acute phase and moving on to this chronic phase and what that means and how that's working. And then after Dr. Wright, we're going to have Dr. Rachel Lasko. She is a general surgeon here at Aspirus. And as we've probably all experienced, that healthcare has been a little bit disrupted this last couple of years, but that doesn't mean that we shouldn't continue with our regular preventive care. And Dr. Lasko is going to talk to us about that preventive care and what we need to be doing so that we can remain healthy as we move, as Dr. Elmer said, as we move out of this pandemic. And then I'm pleased to welcome in another one of our students from Michigan Tech. So Olivia Luke is going to be here to talk to us about our HSTEM enterprise system here. And so for those of you that are not aware of the enterprise system that Michigan Tech has, this is an opportunity for students at, I believe from sophomore level on, and Olivia, you can correct me if I'm wrong, an opportunity for the students to have real life experience working with problems that are real in the world, whether that's industry or healthcare. And this is a new enterprise team, and she's going to talk to us about this team.
Great, Kelly, thank you for the overview. I just want to remind folks once we get started here, if they do have questions, there's a couple different ways to send in questions. You can email us at townhall2020@mtu.edu. If you are on the Zoom webinar here, at the bottom, there's a Q&A button. You can send in questions that way. We do have a few questions that were sent in advance, and we'll do our best to field any new questions coming in and direct those to the appropriate speakers. Kelly, I'm going to turn it back over to you. I know that you'll kind of set the stage with how things are looking here locally and regionally with case counts and COVID-19 trends. So I'll turn it back over to you.
Sure. So I'm happy to announce that things are getting better. So we are here in a bit of a lull. So daily cases and deaths are significantly down from where they have been previously, certainly with the Omicron surge. So we're down nationwide to about 25,000 cases per day and under 1,000 deaths per day. So still people are dying. This isn't something to sneeze at. but we are in a much better situation than we were last month, and certainly than we were at the peak of the Omicron surge that we were seeing. And one of those things, as things are getting better, we've noticed that there's been a change in the metrics that public health is using to kind of describe what's going on in our communities. And this had just happened at the start of our last meeting. But for those of you who keep track on CDC's website and how community levels have been marked and measured, we now are really looking and focusing more, instead of just daily case counts, we're looking more at how much of this pandemic is disrupting our healthcare. So what are our hospitalizations and our healthcare capacity? How are they being affected by that? So with these new metrics, then Houghton County and most of the country is actually in a low risk level. So it's not a transmission level as much anymore as this greater risk level. So we are in a low level. Most of Michigan is also in a low level, except an area around Traverse City, and that is not. It's not because of their case rates. It's because of their capacity within the hospitals. So they have a higher percentage of people who are being admitted to the hospital with COVID. So we're really looking at that impact on our communities. So I do want to remind people that the best thing that we can do to help us get out of this is to get vaccinated. So as you are more vaccinated and more boosted, you're more likely to have not get infected at all. And if you do get infected, a milder case, and certainly we know that this protects you against, really does decrease your likelihood of a hospitalization and death due to COVID. And then we also have treatments available that we didn't have a year ago. And so with all of those things together, things are looking up. Never count your chickens before they're hatched. This virus is going to continue to mutate, and we are going to continue to see new variants. How those variants work within our populations remains to be seen. But for now, we're looking pretty good here in Houghton County. We've got pretty low numbers of cases, as well as having a low percentage of our population that is getting hospitalized because of this, but we could do better on vaccination. So we're looking only at only a little bit more than 50% of our population is vaccinated and boosted. So we could be doing a lot better on that.
Thanks, Kelly. A couple starter questions here. There's already a question about a second booster shot and information from the CDC. Could you elaborate a little bit on that? If these are available, who's eligible, et cetera, and what you're hearing?
Sure. So this is new that just came out. So there has been approved by the FDA and recommended by CDC for a certain subset of people to get a second booster shot. So we absolutely know if you don't have your first booster shot, get your first booster shot. We know that is very increases your protection over just having the 2-shot series, or if you had the Johnson & Johnson, the 1-shot series. So absolutely get your first booster. People who have been severely and moderately immune compromised have been eligible to get a second booster shot already, but the guidance has now increased for that eligibility. So anybody over 50, as well as people who are severely or moderately immune compromised, are recommended to get a second booster shot, as long as it's been at least 4 months since their previous booster shot. So that guidance is changing. We are always learning more as things happen. We learn more, and we're learning more and more about what we need to do. So I certainly know my son keeps asking me, am I going to have to get another booster? We don't know about that at this point. This is what we know now. But for those people who are at that severe risk, getting a second booster will increase your protection.
Kelly, can you tell us a bit more about this Omicron subvariant, the BA.2? What is this? How concerned we should be about this? And we're hearing, especially in Western Europe, the data are indicating that the cases have increased there. And should we expect increased cases or a surge here in the near future?
Sure. So BA.2 is it's within the strain of Omicron. So it's basically a variant within Omicron. It's within the genealogy, the family history kind of Omicron. It does appear to be more infectious than Omicron. So for everybody that has a case, it's more infectious. It seems to be along the same lines as Omicron, as the original Omicron, where that it replicates more in your upper respiratory tract. And so that makes it, when you're talking or you cough, or you sneeze, all the virus is right there in your upper respiratory system and ready to be spread to others if you're not practicing good hygiene and covering your sneezes and wearing a mask and staying away from others when you're sick. As it is relatively new, so we're continually learning more information. At this time, it does not seem like it's more severe than the original Omicron. So the severity seems to be about the same as Omicron, which means that if you are not vaccinated, this can still kill. This is still deadly, particularly among the people who are not vaccinated or unable to be vaccinated or immune compromised. All of those same risk factors that we've seen before, really those people who have those pre-existing conditions that put them at higher risk need to be vaccinated. As far as what we will see here, we're getting better as epidemiologists to be really careful to say we don't know. That it's a bit of an unknown. We generally have seen in the past, we have seen when Europe has a peak, we have then seen that about 3 weeks later, we see that same pattern show up in the United States. Our populations are different, however. And so as if we one of the things that it does help is that we know this is happening in Europe. It gives us at least 3 weeks of opportunity to say, hey, get out and get vaccinated. We can blunt any of these peaks by protecting ourselves, making sure to do all the things that we've been promoting since this all started. If you're sick, stay home. If you if you're positive, tell the people around you that you're positive so that they can protect themselves and protect it from spreading further. Get vaccinated, wash your hands, keep yourself healthy. All of those things that we've been doing, if we've got to keep doing in order to see if we can try and blunt this. But by the fact that it is much more infectious, and we are getting back to our normal lives, that means we're around more people, then there is the risk that we're going to have this big peak. Hopefully, if we can keep people vaccinated, then it's a peak of infections and not a peak of hospitalizations and deaths.
Got it. Thanks again, Kelly. We'll certainly have you back here a little bit later in the program. We want to keep the discussion going. Next, we're going to welcome in Dr. Keith Wright, who is a physician in internal medicine at UP Health System Portage. So Dr. Wright, pleasure to have you on. And you're going to tell us a little bit more about long COVID, what that is and what we need to look out for and how serious this is.
Thank you very much for the invitation tonight. As mentioned, I do work primary care at UP Portage here. My training is family practice, but I do internal medicine by work now. But that being said, yes, the invite was to talk about not just the initial COVID, which has been discussed a lot over the past months, but talk about the effects afterwards, the kind of what it is, what things we can look for, how we can treat these things, and what to expect and what to let our primary care and all of our providers know if we're having these type of symptoms. So basically, post-COVID infections has been called many things. I have a few little notes with me just because it's hard to remember all the exact names, but basically in a nutshell, long COVID, chronic COVID-19. It's also been called post-COVID symptoms, pretty much suggesting of something that's persistent at least 3 months after the initial onset. It's things that persist on, maybe not the exact initial complaint of respiratory, breathing or other issues, but things that just, they don't go away. So we have a couple of options here. First off, I will openly admit we're new into this game. COVID really didn't make its appearance until almost 2 years ago. Things will change. What I tell you tonight may be right next year. It might be wrong tomorrow. So that's just something to be thinking about. This is what we kind of know right now. Things will keep evolving. Typically, what we're looking at is symptoms that develop after an infection. Typically, the more sick you are, the higher risk these are for occurrence. If you're vaccinated, probably a little less likely, which is great news and another reason to get vaccinated. Theoretically, some of these symptoms might develop in people with minimal symptoms, meaning very mild COVID infections. Now, when we say post-COVID, it can be a lot of different things to a lot of different people. The classic ones I'm going to go over are typically fatigue, cough, shortness of breath, chest pain. That's some of the more prominent ones that you would, quite likely notice. But it can also take the form of anxiety, depression, post-traumatic stress disorder, effects on concentration or memory. So there can be other assets to it, or I should say facets. Occasionally you get other symptoms. Well, I shouldn't say occasionally. They're lesser, but they're certainly common as well. That would be things like headaches, appetite, hair loss, change in appetite, appetite, smell, number of other things, sweating, diarrhea, some GI symptoms. Those are also included in that list. Typically, the most common will still be the fatigue and the shortness of breath. That's the major ones, at least statistically. Less so will be chest pain and the cough. Some of these symptoms can last a matter of weeks, some can last months, some can last actually quite a bit longer than that. A couple of general guidelines traditionally would be shortness of breath, chest pain, cough, probably 2 to 3 months range. Not forever, but it lasts quite a long time. Smell can last on average up to a month, but there's many people that complain of it lasting far beyond that. Memory, concentration, anxiety, mood, that's definitely in the range of talking weeks, if not months, and that one can be highly variable. The reason this is important, as our epidemiologists can tell you better than I, we've had a lot of people in the United States infected with COVID. Last I checked, it's somewhere over 77 million. And we're averaging about a third of those folks will actually have some symptom persistent for a period of time. Even I, doing the math, goes, wow, that's a lot of people, which it is. So the one thing that I do want to throw in, and I wasn't sure where to put it in, the one thing that we look for a lot as a side note is related to blood clotting. That's one of the symptoms that maybe weeks afterwards, we have a hypercoagulable state. What that basically means is after the infection, which is very inflammatory, huge amounts of inflammation in the system can increase the risk of blood clots. So that's one of those things that if somebody weeks down the road starts to develop things such as a blood clot in a leg, which might be a hot, red, swollen leg, could be an arm, changes in the toes, chest pain, new short of breath, something to suggest maybe we have a blood clot that's occurring, that's something we want to keep out and watch for as kind of a separate entity. It can develop later. And when that does, please let your medical profession know, seek attention, because that's something that can be very important and something we've had to watch a lot since COVID came out. Now, for the tougher part, there's not a blood test, there's not an x-ray, there's not a magic wand that says you have post-COVID, which is, well, it's problematic. So it's basically taking into account your symptoms, your history, and your exposure, COVID, but also then factoring in the tough question, which is this new symptom from COVID? Is this new symptom something else? Perhaps the chest pain isn't COVID, and actually after 55 years of a medium good diet and a bad family history, maybe I have developed heart disease, why I'm having chest pain. So there's some parts of this I want to also mention that just because your symptoms might be on the list, you still want to get it checked out to make sure that's the major cause and that it's not actually something else starting to creep in. For severity wise, typically speaking, the sicker you are, the more likely you're probably going to have some of these symptoms. If you're less ill, we hope it's a shorter duration, less severe. With vaccine, we're typically seeing a little less severity, which is another great reason. You don't want to be laid up after you get over COVID. Now, once we figured out you have something like this, the good news is some of these things are treatable. And a good example is going to be your cardiac and your lung stuff. That's going to be the shortness of breath, the pulmonary issues where you just can't get back to your previous performance. We're actually recently, I think the beginning of this year, if I'm not mistaken, started to going down the road of like pulmonary cardiac rehab, where what we used to do after your heart attack, after your COPD, we now use physical therapy at one of the hospitals to help you get better, breathe better. Other things are addressed in different manners. Example, fatigue. We don't have a pill to make the fatigue better, but we do realize that we need to get our rest, treat ourselves well, take care of our other preventative needs, which we'll be hearing about in a couple of minutes here, and just take good care of ourselves and allow time, with time being the primary factor, to allow us to get better. When you're looking at the issues of anxiety, post-traumatic stress disorder, depression, rather that just because of lifestyle changes that happen because of COVID, because of the ongoing effects after your COVID, perhaps you may have been in the ICU, you may have been very, very sick on a ventilator. These are still treated with, number one, hopefully in time it gets better, but we still treat that with your counseling, with your specific treatments that we've always had available. So the key note there is if you're feeling these things after having COVID, please let someone know there is help available. You don't need to just put up with it. Otherwise, some of the things, unfortunately, are a little more problematic, the loss of smell. It may not sound huge unless you're the one that can't smell, The problem with that is it can take a month, but it can take longer. It also really screws up your appetite. It changes a lot of things if you can't smell your food. Other than that, like I said, would be just watching out for the major things. It's going to be, is something new going on? Do we have new symptoms after you're getting better? That's when we want to please let somebody know about it. With regards to a few of the other ones, memory, cognition, that's a fairly more complicated matter. And that's more dealt as a case by case type of treatment. Lastly, we're talking about return to activity, school, work, and other activities. As mentioned, the sicker you are, probably the longer it'll take. Otherwise, it's just kind of a slow progression back to your normal activities, not overdoing it, but most people do really well and are able to get back to their normal activities, which is great. However, there's a subset of folks that will eventually have symptoms that last quite a length of time. It's actually to the point where under the Americans with Disabilities Act, they've included this disorder. And hopefully there won't be many, but there's some that will have ongoing symptoms that significantly impair their function, either in social or work or family. So that's kind of a nutshell of what this is. I could have gone on this topic for a long time, but we have a lot of other good stuff to go over. So I just kept it kind of short. Moral of the story is, get your vaccine because it reduces your risk of getting this, reduces your risk of getting COVID, but certainly after COVID, if you are not getting better, whether it be your breathing, whether it be mood, whether it be panic attacks, post-traumatic stress, just don't ignore it forever. Please talk to someone. We have treatments. We want to make sure there's not something else going on. That's all I have for tonight. Thank you very much for your time.
Thank you, Dr. Wright. An excellent overview there. Really appreciate that. Can you clarify, is it that with long COVID, so to speak, are the patients, individuals not fully recovering from COVID, or are they recovered and then the symptoms can reappear weeks or months later?
Most of the time, the symptoms are kind of present throughout the course. Now, theoretically, I suppose if you're feeling better, you might ignore some of them because you're 90% better, but then you're going, that never really did get better. So I could see that as a scenario. The one very specific one that I made mention of is, like I said, a few weeks later, maybe a month, you're going, chest pain, can't breathe, new blood clot. That one sneaks in a little differently. It's not completely part of this syndrome, but I bring it in just because we see enough of it. I'd like to make sure folks are aware of it.
Next question. If folks have these symptoms or they have concerns that they might have this, what are the first steps in seeing their primary care provider? If there's maybe delays getting into the clinic, do they call you? Do they go to the ER? Where do they even start if they're concerned about this?
Well, most of the time it's going to be contacting your primary care doctor or nurse practitioner or PA because they know you best. I know nobody. I'm just giving an overview, but they know you and they can kind of work through that. Now, obviously, if it's something where you're going, I can't breathe today. I got crushing chest pain. Call them as you're going to the hospital. I mean, that type of stuff is urgent, get evaluated. But I'd like to think most of the offices, practices up here have that flexibility saying, yeah, we need to talk with you and work on this. I am not the expert on post-COVID by any means. I'm just kind of doing the overview so you all can get to your physicians and nurse practitioners, PAs. These folks know you better, which gives them a huge advantage of helping you.
I wanted to check in with Kelly. Kelly, I know there's it looks like this came in from a student here, a question in the chat. Are you able to see that? And can you help us field that or direct that to one of our speakers?
Sure. So the question is related to natural immunity or immunity that you get from actually having COVID versus a vaccine. So to be clear, the public health guidance is absolutely to get vaccinated, even if you've had COVID. So if maybe you had COVID last year, get your vaccination, see your primary care physician or the health department to talk about if you've recently had COVID. So there is a bit of a timeline as to if you've recently had COVID and you haven't been vaccinated, but we do know that you're better off still getting vaccinated even if you've had it. And the reason for that is because we know at a population level, we know what happens when you get vaccinated in terms of your immune response. So we've done the studies of that. We know, and it's a more consistent response. So there's always going to be some people with any vaccine, for whatever reason, they don't respond. Maybe they are immune compromised and their immune system just doesn't create as much of a response to a vaccination. But there's a lot more variation in the immune response when someone is sick with COVID. And so it may be related not only to them individually, but the severity of their infection. And so you're not, just because you've had it, you're not necessarily fully protected. And that's why we have the recommendation to still go ahead and get vaccinated. The other thing, and this is true with both natural immunity and with vaccines, that, the vaccine was created against the original Alpha variant. We know that the vaccine is still protective against Omicron. But we also saw that if you had Delta, you still were at high risk of getting Omicron. And so that natural immunity it's not the be all to end all by any means. You're still at risk for getting it. And sometimes you're more at risk than if you'd been vaccinated. Dr. Wright, I don't know if you wanted to add anything else in there in terms of the immunity from the vaccine versus from an infection?
Sure, absolutely. So from a clinical side, it's anecdotal, but it's clinical, and I've seen enough times that I've seen multiple infections in the same person, where they'll pick up the first one and then I'm like, well, that one probably was Delta. Guess what this one probably was? So the natural immunity, although it probably does some good, it's just not enough. You get more out of the vaccine, which is because, again, as you mentioned, we're still boosting with the original vaccine. And over the years, my understanding is we've made Delta vaccine, we've made others, but they've never made it because the original is still doing a good job against everything thrown at it, which is pretty amazing given the mutations that we've had. So yeah, unfortunately, or fortunately, we have an option and it works probably better than the natural one, because again, I've seen it where you get the first one, you get the second one. Now that doesn't mean you're not going to catch COVID with the vaccine, mind you. The goal is for you to stay away from me. Generally, meaning you're not sick enough to be in the hospital, you can stay at home. Someday we drive this thing back to be a common cold, we hope.
Thank you, both Kelly and Dr. Wright. I just want to welcome any new viewers or listeners that might be tuning in. If you're out on the radio on 97.7 The Wolf or Q107, we're here for the COVID-19 Community Town Hall. We have a panel of experts here tonight providing information about COVID-19 and general health and answering questions along the way. If you do want to see some of the visual content, the easiest way to do that, again, if you're on the radio, is continue to listen, or you can hop on over to thewolf.com. Once you're on the page, you can click on either Zoom or Facebook and join us. Next, we want to welcome in Dr. Rachel Lasko, who is a general surgeon with Aspirus and new to the area. So welcome, Dr. Lasko, to the community. And she's going to tell us a little bit more about preventative measurements and things we can do to keep ourselves safe and healthy in general. So I will turn it over to her.
Okay, great. Thank you so much for having me. In this age, or in this period right now where we're out of COVID for the last 2 years, getting out of COVID for the last 2 years, we've really seen a huge decline in preventative care. Not that it's not available, but that people haven't been getting it for the last 2 years. So we're really kind of behind the 8 ball right now. This comes in a lot of ways. So people that have issues like things like colon cancer, breast cancer, that may have been brewing over the last 2 years that haven't been identified or dealt with, still have those things and haven't been in to see their doctor. So it's really important. The point of my part of this talk tonight is to let everybody know that it's really important to make sure that you're following up and seeing your doctor regularly. So let's talk a little bit about what preventative care is. So preventative care starts with an office visit, usually with your primary care doctor, your nurse practitioner, your physician's assistant, all excellent resources. Usually you go in and they meet with you, talk to you, and want to know what your new symptoms are. If you've had any of the symptoms Dr. Wright just talked about, if there's any other changes that you've noticed, or if you're having pain anywhere, that kind of thing. One of the things I hear a lot is I hear patients say, I don't like seeing doctors, which I understand because I don't personally love seeing doctors either, but it's for a good cause. And if we can catch things early, it's always better than if we catch them late. So things that I'm talking about specifically, so the primary care after patients see them will often get referred out to a specialist or referred out for radiology exams. So things like breast cancer, we know that the recommendations right now are that for women that are 40s to 50s, depending on their risk, are recommended to get mammograms every 1 to 2 years. So if you haven't seen your primary care doctor and you fall into that category, those are something that they're going to recommend for you to have. And that's a simple thing. So for people to go and get a mammogram, that is just a quick test in radiology that they get done. And it's not great, but it's a same day procedure, and you go home and at least you have a little bit more information about your overall health. Where the surgeons come in, because I'll touch on that since that's kind of my area, is we do a lot of colonoscopies. So I have 2 days in the operating room every week. 1 day is designated for colonoscopies only. So we do 14 colonoscopies in 1 day, typically somewhere around there. And I know there's 3 other surgeons in this area, so there's a lot of colonoscopies being done. But what that also means is that in the last 2 years, there's been a lot of colonoscopies that have been missed. So the operating room shut down for a period of time in 2020 and in 2021, depending on where you were living, and depending on CDC recommendations. So that whole section of people that were due for colonoscopies now are still due and haven't had them. So we're going to get a little bit backlogged. So it's really important to get on those. One of the things I'll just put in a little plug for myself right now is I'm new to the area. So my schedule is relatively open. So I have lots of time to do lots of colonoscopies for anybody who's interested. The recommendations have changed a little bit. So it used to be everybody waited till they were 50 years old to get that done. Now, fortunately or unfortunately, the recommendations is 45 years old. So that's been updated in the last 3 or 4 months. And the reason is we're finding cancers in people in younger ages. So we're trying to prevent that from happening. Most of the time, 90% of the time, people come in to see me, they have their procedure done. We find either nothing at all, and then they get 10 years for their next colonoscopy, or we find something like polyps, something along those lines. And then it's somewhere between 3 to 5 years for their next one. But the reason is if we take out polyps, or if we do the preventative care side of things and we get rid of those problems that you have now, they don't become cancer 5 to 10 years from now. And I will tell you, as with every type of cancer, every type of preventative health issue, if you find it early, you can deal with it much easier than you can when it gets more advanced. So I would just encourage everybody to get those done. One of the other recommendations that's new within the last several years is for things like lung cancer. CT scans are now recommended for patients that are 55 to 80 every year if they've been smoking for more than 30 years. So that is kind of a newer update to our screening protocols. And then certainly pap smears for young women, prostate exams for men, all the stuff that nobody really wants to have done, but can really, really, potentially save your life if you get those accomplished. One of the things I also get asked frequently is, will my insurance cover this? So most of the time, yes. The best way to find out if your insurance will cover it is to actually call them. So on the back of your insurance card, everybody's got it. There's a phone number directly to your insurance company. They can look up your plan, and they will be able to tell you specifically if they will cover it or not, which is great, because most of the time, if it's for preventative health, it will be covered. There are instances where it's not. It's always better to know that ahead of time before you get it done, before you get a big bill in the mail. But, a lot of the times this is something that's important, because insurance companies recognize they're going to spend a lot less money, and you're going to spend a lot less money if they treat something early as opposed to later. Right now, one of the other things we should talk about is it safe to come in and have these things done? And I will tell you that right now is probably the safest I've seen it in a long time. So I just moved up here, but I was downstate in the middle of Michigan for a while, for the last 2 years, actually. And there were times where the operating rooms were closed and the hospital was overflowed with COVID patients. And we had a lot of patients that were very ill and dying from COVID. Things are significantly better now. And this is the time really to start recovering from the preventive care we haven't done in the last 2 years, and get these things done and make sure that everybody's healthy and well.
Thank you, Dr. Lasko. A couple of questions here for you that are coming in, and we have here that were sent it ahead of time too. thinking if you have a non-emergency surgery, up until now, typically a negative COVID-19 PCR test was required. Could you just comment, is that still the case? And if somebody does test positive for COVID, how long do they have to wait, as it could be a couple of months, right, before they could reschedule that surgery? Or could you just describe that a little bit more for us?
Yeah, absolutely. So I will say that is hospital specific. So hospitals make their own guidelines. They try to follow usually CDC guidelines is where they're getting their information from. At Aspirus currently, they still are testing all of our patients before any procedure. Even emergency procedures. It's just really for us to have some more information if we need to wear N95s, but everyone's getting tested still. It's to help, we think about it as we're keeping our OR staff safe, because if we don't have an OR staff, we can't do these procedures. So if they all get sick, they won't be available. I won't be available. And then to keep the patients around them. So, like I said, I have 14 patients coming in for colonoscopies in a day. They're all in the same area that morning. So we want to keep, if you have COVID, we want to make sure that we're keeping the rest of our patients safe. Typically the time frame is 2 weeks. So after you have a positive test, we wait 2 weeks before we reschedule. And that is just time. That is the information we're getting from the CDC to postpone, to make sure that you're not infectious anymore.
And tell us a little bit about March. We know we're spring here in the UP, it's the 31st, but about increasing awareness for colorectal cancer. I believe that's Awareness Month, right?
Yes, absolutely. So, yep. So March is a great month. It's, everybody thinks it's odd that I do colonoscopies, but it's really a community service almost, because it's so important. Like I said earlier, having a few polyps during a colonoscopy is a big difference between having a cancer. Having a couple polyps, you come in, the procedure takes half an hour, you go home that day, and then you're done for the next 3 to 5 years. Having a cancer means, a big surgery probably, and then probably chemotherapy and radiation. So save yourself all that trouble and just to get it done and over with.
Thank you. We're going to move on to our next speaker. I just want to pause here and briefly. We're about a little over halfway through our COVID-19 community town hall. I want to thank and recognize our sponsors, which include UP Health System Portage, the Michigan Health Endowment Fund, and the Blue Cross Blue Shield of Michigan Foundation. We have a panel of experts here tonight answering questions and providing information on COVID-19 and preventative and general health. Our next speaker, it's my pleasure to welcome in Olivia Luke. She is an undergraduate student here at our university. She's going to tell us a little bit more about the student team that she works with called the 8STEM Enterprise and kind of what their role is in helping solve health problems for our community. So Olivia, take it away.
Thank you, Dr. Elmer. Yep, so my name is Olivia Luke. I'm a first-year biomedical engineering student at Michigan Tech, and I am part of the 8STEM Enterprise. For those who don't know, we are a team of 20 students from all different types of majors, some including biomedical, mechanical, and electrical engineering, as well as biochemistry and biology majors. Our goal as a team is to really improve the health and well-being of our community through the application of innovative science and technology. Our team offers a very real-world experience in the health and STEM field for all students at Michigan Tech. It doesn't matter the major, through working on projects that really focused on health and technology. Some of our project areas include rehabilitation engineering, where we currently have 2 ongoing projects. One is the knee recovery device team, which I am part of, and also our supportive treadmill team. We also work with healthcare, in which last semester we assisted in improving the efficiency of the COVID-19 testing center in the Memorial Union building to really just improve and speed up to make the process simpler for students going in and out of that testing center. And we also focus on just general awareness for health and promotion across campus. The way we approach these projects is we take in a clinically oriented problem given by a healthcare professional, and we simply develop a solution for it. We spend our weeks designing, building, testing out these solutions, and then our long-term goal is to really apply them in a real clinical setting. And that is where healthcare professionals are then given the opportunity to implement it into their everyday practice. However, in order to continue and expand on these projects, we are continuously looking for collaborations with physicians, engineers, even industry workers, to really help aid in the process of pioneering solutions to these daily problems and challenges that they're seeing. Ironically, this enterprise was formed in the midst of COVID. And as we all continue to move forward through it, our enterprise specifically is really focusing on expanding the ways that we can better the lives of those across our campus and throughout home and possibly even further. But thank you so much.
Olivia, tell us a little bit more. We do know we have some students tuning in tonight, even some high school students. If they are interested in learning more about this, how can they visit you or approach the HSTEM enterprise?
Yeah, so we have general meetings every Tuesday from 6:30 to 7 p.m. in room 613 of the Minerals and Materials building.
A question here came in. This is a great question. So you're interested in health. You're a student taking courses in health and engineering during a health crisis, a pandemic. How have these experiences here maybe altered or influenced your long-term career plans?
They've definitely given me a perspective of a really team-like environment. And it's also both applied the health side and also the design process of all of it together. And it definitely prepares you for the workforce. And it also gives you great leadership skills, not only through our executive board, but also in just the team-like environment as well. You learn to really take in input from all different sides, both from all different majors, from mechanical engineering to our biology majors, and we all end up working together to really get to a useful solution in the end.
Yeah, you're right. A robust health workforce is really important as we look ahead. I want to connect a few dots here. Dr. Wright mentioned long COVID and the importance of respiratory and physical therapy. If there are respiratory therapists out there, physical therapists, you mentioned physicians, but other healthcare workers that may be experiencing, of course, some challenges. Can they reach out to the team and see if there might be a way to collaborate? What do you think?
Absolutely. Yeah, we definitely want to be able to collaborate with new people and start new projects. We just need a little bit of insight of what we're looking into, and then we definitely start the brainstorming and design thinking process when it comes to what we plan to have as a solution for you in the future.
Great, and we'll help you out here if there are any clinicians out there or community members that want to get in touch with the HSTEM enterprise. You can send it email to townhall2020@mtu.edu, and we'll be happy to forward that on to Olivia and her team. I want to thank you, Olivia. I want to welcome Kelly Cam back into the discussion here. Kelly, we made it through all of our speakers so far. Anything jump out or stand out before we open it up to some broader questions for the whole panel?
I think all three have mentioned that this isn't something that's short term, right? We've had an acute phase of this pandemic, and actually within public health and emergency preparedness training, we see this all the time. So as you get to the recovery aspect of things, and we're not necessarily even quite to the recovery, we don't know what's going to happen next, and hopefully we don't have another big surge. But there's going to be impacts on our lives, on our clinicians' lives, on our students' lives that are going to reverberate throughout, as well as our patients throughout their life. And so I think to think about how this, what can we learn from this? How can we move forward? Does this mean, like with the AIDS pandemic, that there are people, or the 1918 flu pandemic, where there are people now either in there that are already working in these fields, that now their career is going to be about post-COVID patients, or how do we deal with the long-term implications of people who have not had that preventive care, and those patients that now have more advanced cancer than they would have had if we hadn't have had this, or students who now look forward to a career in a direction they wouldn't have gone. So I think this isn't going to be necessarily all the way ever over, because it's going to change us permanently.
As always, Kelly, really appreciate your expert analysis and perspective here. It really complements our visiting speaker panel that we have. We do have a couple of questions that we're going to open it up to the panel. The first one I want to direct towards really Dr. Lasko from Aspirus and Dr. Wright from UP Health System Portage. This question is getting at telemedicine, and it certainly existed before the pandemic, certainly came to light during the pandemic. Could you just briefly collectively touch on maybe some of the advantages and limitations of telemedicine, and do you see this as a key component in healthcare as we build forward out of the pandemic?
I guess I'll go first. Can you hear me?
We can. Go ahead, Dr. Wright.
All right. Yes, it did exist prior to that. And obviously, given the fact that we had closures of hospitals, or at least restrictions in hospitals trying to keep people separated, it's been an amazing tool to offer services during this time. But what's probably much more important in many respects is its ongoing change, because places like here, places in the middle of Alaska, the middle of Montana, this is now offering services that we've never dreamed of having. If this comes to its full, well, hopefully to its better side, we're going to be seeing that we have services for so many things that are lacking throughout a lot of areas. Here we need a lot because we have a large landmass, relatively few providers, a fair amount of people, but we don't have enough providers to cover all of our specialty needs, whether it be rheumatology, neurology, whatever it may be. This is going to, I think, be an ongoing wonderful service to not just us, but large portions of not only our country, but potentially expanding throughout more globally to the parts of the world where they don't have medical resources where you can have them. I think it's a wonderful change that's taking place. Now, obviously, it doesn't apply to everything, i.e. our nice colleague in the surgical field, a little hard for her to take the appendix out from home with her iPhone, I think, but she can tell me more.
I don't think robot technology is quite there yet, but yeah, I think Dr. Wright's point is great. You know, with our resources, especially, I would say from a hospital side of things, being able to have access to specialists online, either, you know, for patients that are in the hospital or even the clinic setting where I have questions or the patients have questions, I think it does give us a lot more resources. This actually brings me to a topic that I wanted to talk about, which is that right now, there's such a thing as, it's called a direct access colonoscopy, which is a fancy name for basically you don't have to come in necessarily and see me or my partners before you get your colonoscopy done. And that is for patients that meet certain criteria. So basically those patients would get a referral from their primary care. A nurse would call them and have a discussion about their overall health. And then they might not have to come into the office and into the hospital before we just get them set up for a colonoscopy, and they meet me, you know, before the procedure. But that is another way that we're trying to help people to move forward and not delay care so that people can get in sooner to get their procedures done.
Thank you, Dr. Lasko and Dr. Wright. I had to unmute there. It happens to the best of us. I wanted to just adapt the question for our student on the panel, Olivia. You've been a student through the pandemic and had to adjust with in-person and remote learning, and you're here on campus. From your perspective as a student, are there any advantages and certainly limitations to remote using Zoom? And as you go forward in your career, what are your thoughts on using Zoom and using the distance learning in the future, I guess?
I definitely think there are both advantages and disadvantages when it comes to it. There is a struggle when it comes to one-on-one like help, especially in-person hands-on help, especially at an engineering school where that's very useful. But it is very accessible to many people, and I think it's an easier way to have like quick meetings, and it's a lot simpler than having to walk across campus. I do think it's a great way to have simple meetings and get smaller help, but larger help as a student where hands-on is needed, or just being in person and seeing and being around other students as well can be really collaborative and helpful through that as well. So there's the advantages and disadvantages, but it works.
Great, appreciate that, Olivia. And I think in theory, we'd say that there may not be many snow days in the future if we shift to Zoom that day. So I don't know if the students will like that, but I wanted to bring Kelly back in here. Kelly, I know there was a question about some recent evidence with links between COVID and potentially diabetes. Did you want to help direct that to potentially our physicians on the panel?
Sure. So there's been a couple big studies lately that have really seen that so there certainly is the impact of long COVID, of the disease still sticking around in some way, shape, or form. But there's new evidence that, in particularly diabetes, if you've had COVID and getting the risk of new diabetes being diagnosed relatively shortly, up to a year after the COVID diagnosis, and it is certainly more, does seem to be, at least with most recent paper that came out that it's more common in people who are already high risk for diabetes. So my question for Dr. Lasko related to this is that if people have already kind of avoided or put off that preventive care, and now that they maybe have recovered from the COVID and they don't have these long-term complications from COVID itself, what would be guidance that you would say in terms of should they be doing to kind of keep an eye on that risk for diabetes?
I think this is a little bit outside of my expertise as a surgeon, but I think regardless, if you've had COVID, and I guess I'll ask Dr. Wright this too, but I think it's a great idea if you haven't seen your provider yet to really get in and see them. Because they will check your lab work. Most providers will check your lab work once a year. Signs of diabetes would be, obviously elevated blood sugars. They would be checking all of those things. Other signs, other physical exam findings, if you did come into the office to be evaluated, those are all really important. It's interesting you bring up this research article because we have seen just such a wide variety of post-COVID complications or issues. I've seen people with increased acid reflux. I've seen people with all kinds of GI bleeds. I know we talked about clots earlier, but on the opposite side, bleeding issues. So really, I think there's gonna be a lot of data that comes out soon to talk about all these complications and post-COVID issues that we're gonna be finding, that just a wide variety of things that come up.
So Dr. Wright, on that same kind of thing. So I'm thinking now we've got one of the reasons that we from public health have looked more at these hospitalization rates instead of case rates is people are getting more home tests. And so and not necessarily getting a test where the doctor's aware of their results. So given that we are seeing some of these impacts at this higher risk for diabetes, that as a primary care, should these individuals, for one, be making sure that their provider knows that they had COVID? Are doctors is it going to be a standard question to see, have you had it, so that we know to be a little bit maybe more aggressive for checking some of these symptoms? What should a patient be doing in terms of making sure their provider is aware of their risks?
Well, definitely, if you're coming in, let us know. There's a number of questionnaires that one will encounter in most offices, but it's always just nice to say, yes, I've had COVID. And based upon the frequency of the COVID cases, the home test, quite often, if you've had a positive, it's in a time when we had a high rate, it probably was a true positive. So that part we're not going to debate very much, but yeah, we would like to know that. And it's not just, it's the COVID. And as you mentioned with the diabetes, that's going to be part of our standard screening, as you already alluded to, for your preventative measures. Yeah, you'll come in for your yearly checkup. We're going to check everything from typically cholesterol, the cancer screenings as alluded to earlier, some basic lab sugar. So that's going to be screened in part of that. So hence, come in, get your wellness exam, and that helps monitor a lot of that. I can't speak specifically to the article, but I guess the general trend we've seen in many respects is COVID has really kind of messed up the health of the humans, because it shut down a lot of the community centers. It shut down the gym. It shut down a lot of activities. People have been at home more. Maybe the weight has gone up higher. Maybe the rates of alcoholism has gone up higher. There's a lot of things that impacted, which wouldn't be a surprise to see diabetes being a byproduct of that, because it hasn't made the world healthier for the most part. And hopefully that'll settle out. But yeah, basically, like our friends have said, if you're coming in for your yearly maintenance, it's a great time to look at everything. And please come back. The hospitals are about as safe as you can hope. I mean, if you look around the community, there's a few masks in the community, but not very many. You come to the hospital, everybody's masked. So it's not a bad place to be.
Thank you, Dr. Wright. We're getting just about to the end of our COVID-19 community town hall here. Tonight, we provided a general COVID-19 updates and also general health information for listeners and viewers out there. I want to give each speaker, including Kelly here, just an opportunity to kind of emphasize the takeaway message that you would like folks to take away from your brief presentation tonight. So why don't we start with Dr. Wright? You went first, and we'll just go around the Hollywood squares here.
Thank you very much. Basically, I went over the high points of post-COVID. The moral of the story, I think, is pretty simple. there could be a lot of things from it. In the future, we'll find out more than we know now. So if after COVID, you are having symptoms that are not going away, just don't ignore them. You don't need to live with whatever it might be. Now, yes, it might be a lack of smell. That's a different story. But if there's something going on with breathing, with mood, come see your provider. These are things that we can start to work with. Just please come in. Don't ignore them.
Great. Dr. Lasko?
Yeah, again, just thanks for having me on tonight. I think to shadow Dr. Wright, we are here, the hospitals are here, we are open, we're happy to see you. Please come in, please come and see us before, you get sicker or before things, end up, we have a more serious conversation than just having a colonoscopy or a mammogram. But the hospitals are here for you, the providers are here for you. It's a great time to come and get checked out.
Go ahead, Olivia.
So the HSTEM enterprise is very new, but we are growing, and we're full of very ambitious and eager and hardworking students, all very passionate about improving the lives of others through health and technology. And on behalf of the enterprise, I appreciate coming on here and getting our name out, and we're very excited for the future of HSTEM.
Okay. Thanks, Olivia. And then Kelly, a quick takeaway from your part.
I think this pandemic has, as we're hopefully getting to this point of getting to the recovery stage, I think that it really has brought forth the importance of understanding that the health of our society is dependent on our society as well as our individuals. And we each have to do our part to keep ourselves healthy, but we also have to do our part to keep other people healthy. And that we have to remember that the inequities, the issues and the inequities that have really come to light throughout this pandemic, these are things that should not be there. These inequities should not exist, and we can use the information that we've learned through this pandemic to try and address those equities and make everybody be able to have that opportunity for help, no matter who they are and where they live.
Thank you, Kelly. Kelly, we've been doing this every month for several months now. Tonight is our 26th town hall. We have one more town hall scheduled next month, final Thursday in April 28th. I'm going to give you about a minute here. I reserve some time for you on purpose. Could you tell folks and community members about kind of our long-term vision for making that transition from a COVID town hall to a more general community health town hall?
Sure. So as Dr. Wright alluded to, that those of us who live up here in the UP know that we oftentimes don't have all of the providers that we would like to have, and that we are in a medically underserved area in many of the parts across the UP. And we don't have a medical school up here, but yet we do have some resources within the university and within our communities to be able to try and bring some health information, that useful health information to our community. And so although we focused on all these impacts of COVID, the idea is that for long-term to be able to shift this and be able to discuss some of those other health concerns that our community members have, as well as our healthcare providers, so that we can kind of help make that connection between the people that help keep us healthy and those of us that are on the receiving end of that health information, to be able to figure out how we can keep our communities safe and healthy for the rest of time, hopefully.
Yeah. And Kelly, really leveraging, like you said, the Health Research Institute here at Michigan Tech, the Center for Rural Health at Northern Michigan University, the various healthcare systems, not just here in the Copper Country, but certainly across the UP. Anything that I'm missing as we're thinking ahead? If folks do have ideas or suggestions for that transition, they can email us at townhall2020@mtu.edu. We appreciate, but anything else that we should give a quick plug for?
Sure. Well, and remembering that there's beyond the healthcare providers, that our health is affected by everything, by our built environment, by all the things and places that we live and work and play. And those are important to be able to keep our health as best we can. So we certainly know that, keeping yourself healthy, exercising, eating right, that makes it easier on our healthcare providers and keeps us healthier as well. So wash your hands. Remember all those things your mom taught you. Or your dad taught you to be able to keep yourself healthy and be a partner in your healthcare, not just a consumer.
Great. Well, thank you so much to Kelly and all of our speakers here, Dr. Wright, Olivia, and Dr. Lasko. Really appreciate you coming on tonight, weaving this into your busy schedules. I know one of our physicians is on call, so no calls that came in, but we do appreciate everything that you're doing to keep our community healthy and safe. Thank you to all the listeners tuning in tonight. We'll be on here April 28th, the final Thursday of the month. We appreciate the support of our sponsors, the Michigan Health Endowment Fund, UP Health System Portage, and the Blue Cross Blue Shield Foundation of Michigan. So until next time, stay healthy and safe, and we'll see you next month. Take care.